Good morning, I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. We're kicking off day 2 with an interview with Shaun Greene, who is with Arches Health in Utah. And now Arches Health is a consumer-governed co-op insurer, and you're the chief operating officer there.
Yes.
So Shaun, what is happening in Arches right now? You've been through some payment reform strategies, and that's really an important aspect of what you're trying to do there as well.
That's our vision. I mean, our vision is to reform the way payments are done, really make it so that the incentives make sense, because they don't. Some of the things we've already done, we've built a primary care network where we've $5 co-pays to really encourage people to go to their primary care provider, because we've seen studies across the country where if you enhance primary care, you can cut medical costs significantly.
Okay. We were also talking about how consumerism is really going to drive some of the change here.
Sure.
And in the end, consumers, the individuals, will really benefit from some of the things that they want to see improve. But there's a lot of education that needs to happen.
Oh, absolutely. I mean, most of the consumers right now, I don't think really understand what's going on. And one of the things that I think we really need to do is we need to simplify the system. I think payment reform will take us in that direction. Not only do we get economic benefits for that, but on the consumer side, by simplifying it, we make it much more consumer friendly.
How do we do that, though? How do we get individuals to understand the process in which they get their health care and how they're paying for it?
I mean, I think most people understand, if you're sick or if you need a checkup, you go to the doctor. So where we're going, for instance, on primary care level is capitation. We actually are doing a pilot this year with a willing provider who has a string of clinics along the Wasatch Front in Utah to do age-banded capitation. And what we really like about that from a consumer point of view, I mean, they've got the $5 copay, but more important, it's simple. Instead of them getting crazy EOBs and, oh, you pay this, you pay that, it's basic, we pay the physician to take care of them. We've aligned those incentives. Okay. And that's what we're looking to do. Let's make the service to the consumer a lot better. And on the primary care level, it does that. Secondary, and this is kind of the next phase where we're going, is global payments, episodes of care, bundle payments for certain episodes of care, whether it's a knee surgery, maternity, whatever it is. And again, there's economic benefits there, but also, like we were just talking about my wife's procedure last summer, she had a great experience. St. Mark's did a great job for her, and she loved the experience. But when she came home, and all of a sudden bills start showing up and payment issues occur, and that's what typically happens now.
Okay. So when we talk about paying for episodes of care rather than a la carte procedures, how will you go about valuing how much that episode of care is going to cost?
There'll be a lot of analysis where you look at, what is the standard cost, if you kind of take all of those codes together for a procedure, and really figure out what that reference price is. This was done back in the early 90s. When I was founding Arches Health Plan, I knew that we needed something of a vision, and that's where payment reform came in. And so I actually went out and hired Lynn Baker as our CEO, who had started the Public Employees Plan in Utah in the 70s. But in the 90s, he started doing episodes of care. I think he really invented the global payment. And what he did with maternity was amazing. He said, hey, we're going to pay you the same price, whether it's a C-section or a standard delivery, and the same price. Well, guess what happened to the C-section rate? It went down, because now there was no more perverse incentive to do the C-section. It was do the right thing, we're getting paid the same regardless. And those are the kind of things that we want to do and drive the economics.
And get back to that.
Exactly.
How confident are you that this is where you're headed? You've done a lot of payment reform strategies already, so are you headed where you want to go and at the rate that you want to go at?
I think so. I mean, it's always hard. It's a simple concept, but it's a very hard thing to do. We've got some great provider partners back in Utah that are interested in working with us. So I feel that we're on track, but it's not going to be easy. I mean, there's certainly going to be a lot of heavy lifting that goes into it.
Okay. Every conference, there seems to be a theme running through it. Accidentally, really, but everybody is talking about the consumer at this conference. What's the message you want to leave about that, and what do you think the theme of next year's conference might be?
Not a prognosticator for next year, but for this year on the consumer, what I would really say, it's really time to create a great service experience in healthcare. Because right now, it's really bifurcated. People have a great experience most of the time when they go to their provider. We got the greatest providers in the world here in America, and people get great service and they love it for the most part. But it's when they come home and all of a sudden the bills start showing up. And that's again where we're really going, because if you can do some of the things we've talked about, you take that away and you can sustain that great experience that they had at their provider. And give people choice. And I think there's a lot of good in the Affordable Care Act that has given people choice. So I think consumerism is certainly on the rise, but it's still got some work to do.
Okay, Shaun Greene, thank you so much for your
Thanks
time
for
today.
having me.
And I'm Mabel Jung. Thanks for watching.